So earlier this week, UCLA announced that they just did their first bladder transplant, and as a urologist, my heart is beaming with pride. Dr. Nassiri and Gill have trialed this bladder transplant surgery in numerous settings prior to trialing it in their first patient, Mr. Oscar Larrainzar. Mr. Larrainzar is a father of 4 and needed a kidney transplant, but also had a non-functional bladder due to the amount of bladder tumor removal surgeries he's had in the past. So let me set the stage for why this is really novel. You have heard of heart, lung, liver, kidney, bowel, and pancreatic transplants. But the reason it's taken so long to consider a bladder transplant is because it is very, very difficult for 2 reasons. Number 1, the vasculature of the pelvis is really, really intricate. Urologists take out bladders all the time for really, really bad bladder cancer. And so we see how intricate it is. I was talking to some of my attendings about this, and because there are larger blood vessels that feed into the smaller blood vessels that give the blood supply to the bladder, that perhaps the surgical team might have considered not just taking the bladder in and of itself, but also taking that extra bigger blood vessel so that it's easier to attach to the recipient's blood vessels, instead of having to connect each and every small, tiny blood vessel. But the second reason why this is interesting is because the innervation to the bladder is incredibly complex. There's a very intricate system and communication between our brain, our spinal cord, and some of our peripheral nerves to help our bladders contract and relax. And so when you're taking the bladder out of anybody, you are severing it from its innervation. And so it'll be interesting to see if the bladder recreates this innervation in the recipient. And so initially, I think that even though the bladder tissue maintains its integrity to be able to stretch enough to hold urine, it may not be able to contract on its own. And so we hypothesize that the patient may still need to catheterize themselves. This means taking a tube called a catheter and putting it through the urethra into the bladder about 3 to 4 times a day in order to empty the bladder of the urine that it is storing. In part 2, I want to talk about the different types of bladder reconstruction opportunities we often give to patients. Hope this is educational.